Watching Buzz with Jess Lujan.
And we're back, main studio guest Senator Dennis Rodriguez Jr. We're talking about the feasibility, possibly building a new hospital based on Bill number 80-33. And again, you told us basically the genesis of the bill. But let me ask you this as well, because there's a lot more, and you know that there's a lot more into building this and making that successful, because we were talking in the break here, is that I remember years back when you know, our choice of places to go for treatment was GMH, right? We didn't really think about stateside and all that, and we never thought about the Philippines. Go to the Philippines? Are you kidding?
That's right.
Bob, but we got the, you know, bad place. No. Now, where, you know, there's a mass exodus of patients that you know, they could probably see at GMH, but they choose alternatives, and a lot cheaper, So, you know, that perception, it took years to perceive that. So we're going to have to, you know, reconceptualize and refocus and ensuring and making sure that image is gone. And how do we, you know, and until we do that, because I heard there's anywhere about maybe close to 60 million, that could be, I mean, a number that I've heard, that leaves our island for medical care on an annual basis.
Yeah,
now,
I think it's more, yeah.
More than that.
Yeah.
So in order, I mean, 60 million that we're paying. I mean, these are not non-paying patients, 60 million that could stay here.
That's right.
And so how do we intend to capture that? Because that's what you're going to need to come back to here, because this is money going that we don't see.
That's right.
This is money that's going to building their other hospitals.
That's right, absolutely. And I'm glad you brought it up, Senator. You know, that's why this new hospital, the Guam Regional Medical City, it's really a blessing for Guam. A lot of people think of it as, well, you know, it's competition for GMH. It's going to.
I love competition.
Yeah, well, it's good. It's good competition,
Yeah,
right?
sure.
But I don't believe it's going to drive GMH down the drain. I think both can coexist. But one thing they're doing is now keeping some of those patients, our people here on Guam for the services. I met with some of them today, and I said, we'll never end our people going to the Philippines, Hawaii, or California.
It won't end, but we can really lower that number.
Yes, you know, we can reduce it. So, you know, absolutely, GRMC is going to reduce that. If we beef up our public hospital as well, that's going to reduce it even further. So we keep people here, right?
I mean, and that's one of the things, again, you know, when you look, I mean, I know the governor is hard at going on his economic missions to try and entice, you know, developers and companies to come out here. One of the things to look for, most especially if you're looking for people to relocate here, to have, you know, their headquarters out here, is, you know, their CEOs, CFOs and all that, they're going to say, well, what kind of schools do you have, you know, in your public schools, not necessarily your private schools. What kind of hospitals do you have? What's your infrastructure like? You know, your power, all reliable stuff. So yeah, and hospital is one of the main things that's either a deterrent from coming to a destination or an enticement to a destination.
That's right. I think one industry that you know, that we've seen that because our healthcare system here was not on par, at least to their standards, is the assisted living facilities. And these are for the silver market, you know, those people in Asia, in Japan, and Korea, that have looked at coming here, sending their older people here to retire, or, you know, several months in a year when it's too cold in their country. But when they look at, you know, when they took a look, you know, several years ago and said, okay, we don't really, you know, we're not confident with the healthcare structure, then, you know, that's a problem. But I'm really confident now that things have changed. You know, we're getting things up to where it should be for delivery for healthcare for our people, and even now to attract these silver market from Asia as well.
Now, again, one of the things you had mentioned, that there's a possibility, I mean, again, in regards to a cost offset.
Yes.
So we move towards a new hospital, find the right place. I think you have Dededo, Jigo, Manila, or some of the places that have been preliminarily identified. Okay, so we fast forward to okay, that's what we're going to do. Now, you said one of the cost offset would be to either rent out the current GMH or outright sell it. Are there any interest at this point, and what could possibly be there? I mean, that can facilitate. I mean, I know there are a lot of things that can go there, but who would want to
And so that's part of the work that the task force is doing, is trying to gauge the interest. Right now, we've concentrated our efforts on the second part, which to me is really important, is the business model. We've talked to different private organizations that have expressed interest in saying, okay, if GovGuam is serious about doing this public-private partnership or some different model than it has today, we may be interested. So we've asked them, look, we're a task force. When the point in time comes that we do this, that it is public policy, understand that you're going to have to go through a process, a procurement process, and in whatever process we set up, because we want to make sure it's competitive. We want to make sure that if there's more than one, that we get the best bang for the buck for our people, right? So we've asked them. So on the surface, initially we got some interest from individuals, from groups out there. But I think in terms of now this facility here, I think what we really need to do is, if we're serious about doing this and serious about not expending money in the existing facility, is develop a reuse plan to see, get experts in here to really determine what can that facility be used for. I mean, it's built as a hospital, right? Some talked about maybe a mixed-use medical facility, so it's really something that I think is down the road, but there's great value to it.
I tell you, as a resident of Jonestown, I tell you, we have 4 towers up there that are empty, okay? And so my idea would be, those are good buildings for a hospital, and where GMH is at, that would make a nice parking lot.
You know what? This is what really inspired me, is that a few months ago, our 4-year-old son was unfortunately had to be in the hospital for a couple of days. My wife and I stayed there the whole time, and so they gave us, it was I guess the time wasn't busy for the pediatrics ward. We got a room that had the best view. I think that's the only thing good about being in the hospital, right? Of course, when you have a sick kid there. But they had the view of Agana Bay, and they had the view of those 4 towers. And I said, the staff, the doctors, they're the best. They're the best. That anyone can have. But when we look at the facility where it's breaking down, you had tarp covering certain sections of the building. The elevators weren't running. I said, boy, can you look at those empty towers there? And what if this? I said this could be very valuable. And if you can make it into something where it'll complement whatever they're planning for that tower. I mean, for those 4 towers, or make it into assisted living facility, because we're working on that track. But there's a lot of value, and that's where we have to think outside the box and see.
No, I mean, again, as one that lives there, the tower's already been built. Okay. It could be a nice hospital, and flatten out that parking lot. It could be a whole parking lot. And again, I want to get back to, again, the perception and bringing that back to be, again, where people will have this as one of the first choices. Again, with that, I just came back from the Philippines a few days ago, and right next to me, a Filipina, which I won't name, but you know her as well. Okay. They just came back and says, hey, you know what? I went there and I didn't know she was sick. She goes, I almost died. I was up at GMH. I was given this medication. I was given Tylenol with codeine, and I was allergic to it. I had, so anyway, long story short with that, she said she went to, of course, to St. Luke's. I mean, she goes, I tell you, and the person that was sitting next to her was also a medical referral patient. They said, and this patient, this lady was sitting next to me, she's been there before. The other one's the first time. She goes, the doctor sat with me. I mean, all the doctors, the specialists that saw her, sat with her, made her understand, didn't leave until she understood. She goes, I mean, I never got that service. So, I mean, I know we're limited in the amount of doctors, and I know, but, the other thing is of course, they have other patients, to see. But those are the things, again, that make people want to continue that. I mean, the added customer service, your doctor, you may know what you're talking about, but, I mean, I know you're speaking English, but it doesn't sound even Filipino to me when you're talking to me in in your medical terms. That's right. And so those are the things that we hear. You hear it. I'm sure you do. That's right. And so as much as we say they're the best, I mean, our medical facilities, I mean, are the best people in the world, all that. But when we get together, we're going, I'm not GMH, man. Bob, I don't want to go there. Yeah, so those are the things, right?
Yeah. I mean, I absolutely, I hear that, and we're not. It's not exclusive to Guam, because I've heard stories like people that go out to the different, different hospitals too, right? But yes, I hear that, and I feel the people's frustration, right? But I really think now with the new hospital opening up, so it's not like people now. I think naturally. the way things operate in our hospital are going to have to also, kind of get
Sure,
up to,
sure.
to
Yeah.
rise, and people's
Sure.
expectations are
Yeah.
more.
Because one of the things, again, when you look at, again, costs, right, increased costs. I mean, earlier, I think a few weeks ago, a hospital was in the process of raising their costs, and I'm going, yeah, that's fine. I understand that because, again, a lot of times when they buy medicine or whatever it is, they can't even sell it for costs because people can't afford it. And I understand you have to make money. You got to get out of the red, right? You got to get into the black. But what we're saying at this point as well is, we understand that. But, if we had more volume patients, we had to do this. And if we got that customer service, if we got that, because the perception, I mean, perception, is everything to a place. I mean, it can make you, it can break you, it can enhance a facility, it can break a facility, okay? And in this point, GMH is not perceived as, again, an adequate facility. You've heard that. I hear that in my radio show almost every day, and again, I know some of the best people that work there, but you're dealing with a system, and I think they're just talking system-wide, and now they have comparables, right? They compare it to other destinations, and they can go, and they say, man, it's even cheaper, and I'm getting great customer service. So this is a holistic look at that. Again, we're very good at building. We're one of the best in building. I mean, look at the police lab. That's fairly new.
Yeah.
Yeah, and as one of the, I think it was a professor that wrote, a retired professor that wrote, I can't believe it. Although we can point fingers and who was the director, administrator there, I can't believe that the person that was working there didn't see that trash or that cockroach.
Right.
It didn't. You didn't go home one night and wake up the next morning and it was there.
That's right.
But anyway, thank you very much. We're going to take a quick break, but I think we're only have